Ready and go.
Welcome back to the Accomplished Brain podcast, where we explore and discuss brain health, neurological disorders, and other current health topics. Today, we're going to talk about balance, and I think it's something that for healthy people is certainly taken advantage of. There's balance in regards to sports performance, where we think of how quickly can somebody shift on one foot, can keep themselves upright, so on and so forth. But then there's also balance that a lot of people suffer from managing properly. And so we think of something most commonly as vertigo, where if you turn your head too quick or you get up too quick, all of a sudden you get dizzy and the perception of the world is swimming by you. So common things are most common we know of is vertigo. You can also get balance issues from simple things like migraines. You can also have issues from Meniere's disease, which sadly we still don't know enough about. There's a lot of talk of it about being a sodium balance issue. There can be a tumor, a brain tumor can cause issues like that. Concussion is a very common thing, throws off the brainstem, throws off the functionality of the cerebellum. And then there's also something called Ramsay-Hunt syndrome, which is also something that is to be more explored, but it's commonly a herpes infection that affects cranial nerves and in turn affects balance. So those are things that we're going to kind of be diving into today, and Andrew's going to break down the pathology aspect of where does balance come from and how we look at it and how we apply the treatment aspect to it.
Great, Jeff. Well, that was an incredible introduction, and I'm so excited today to be discussing this topic of balance. And the reason being is because I think um, one of the markers that I look at almost all the time working with a client, whether they have a concussion, traumatic brain injury, stroke, Parkinson's, movement disorders, well, obviously balance disorder is going to have a balance problem, but almost all these other areas, kids with ADHD, kids with special needs, autoimmune clients who have autoimmunity, I am always one of the most important things that I see out there is always checking someone's balance, because I feel that balance, like some of the other things that I'm looking at, like eye movements or coordination or watching people walk, looking at their head posture, balance is right up there in giving me a marker of how well their brain is functioning. Also, balance is important to see as we give them exercise. So, an example, someone's coming in for sleep, someone's coming in for, focus, attention, and memory. We're still looking at their balance, because balance is really an overall, again, of how well their brain is functioning. And it's also a marker that we could see that as their balance gets better, we know that they're responding in a positive way to the brain exercises or the specific customized brain exercise program that we're giving to them. So it's really an incredible topic today, very important. I did want to share that one of the big things, especially so balance is important at all ages. Balance is important with athletes, okay? And I'm going to go into why balance is important with athletes. I'm going to go into the balance system itself. I'm going to go into I want to talk a little bit about today that, at all ages, especially people that are 65 and older, that one of the important things is decreasing their risk of falling. You see a lot of people that at that age of 65 and above, that their risk of falling increases. So being able to look at their balance, do a balance test, and being able to give them a very customized program to help them, is extremely important. And again, we're going to have a treat today, because as always, we go into application of how to help. And one of the things we've developed over the with my brain exercise software is specific programs that will help the balance system. So really, we got a really good treat today. So Jeff, before we go into some of what is balance, what are the systems that help balance, do you have anything to to add before I kind of get into this?
Yeah, I just think I'm excited to go into a little bit of the balance part from the athletes, because I think it's more of than just what's going on between the years. But I also think it's really important to note that um, healthy people kind of take for granted walking down the stairs, right? And why is that a balance thing? Well, because walking down the stairs is how you're perceiving, right, the world around you. Going to movies that have flashing lights and a lot of movement, so on and so forth with the camera. Going to concerts, all of those things that healthy people just think, well, that's a normal part of life. Well, there are a lot of people out there suffering from vestibular apathy and all different sorts of aspects that just can't enjoy those regular things in life. And that's what's so important about the therapeutic aspect of this, is you're really just trying to get people to enjoy their quality of life. So I think it's important to be noted, is how much we take that for granted.
Yeah, and I agree, and I think one of the things I think Jeff and I have enjoyed of working in the neurospace, whether it's concussion, traumatic brain injury, stroke, Parkinson's, kids with ADHD, movement disorder, balance disorders, kids with special needs. We've been People have memory, sleep problems. What we've enjoyed is a lot of these cases that it really affects their everyday function to the point where they really notice it. And then what happens is when they're everyday, when they could come and see a practitioner, whether it's us or somebody else, again, we really focus on what we do. And we also say there's a lot of really good practitioners out there. But they come in, they see us, and we're able to give some kind of program that's very customized but very simple to them, and they could restore some of those functions, whether it's improvement of the memory, whether it's improvement of the balance, whether it's their headaches are gone, whether it's their focus or attention is improved, whether it's their sleep is improved, their anxiety is less. They really notice that, and they really appreciate, well, I think all clients appreciate their therapist, but even greater, because these functions that they lose, it really affects their everyday life. And then when they get that, when they can get that, they can get that function back, I think their appreciation is even greater. And I think I think they're just more aware of, wow, something, wow, this was out, and this really affected me. I couldn't sleep. I've been sleeping 3 hours a night. I've had a headache, or I just couldn't remember things or process things, or my attention, my focus, or, I just didn't feel steady on my feet. When those things improve, they just, we have we feel great, because obviously we've impacted them, and they just, they feel so great working with us and doing, our program. It's just such a great feeling. So I just wanted to share that. But with that said, I want to talk about what balance is. What are the three primary systems that the brain is getting information? What happens, especially in the a classic example of people who have vertigo? Um, you know, and most people will have um, they'll have um, benign paradoxal positional vertigo, which they call BPPV. And
Mhm.
I'll kind of explain like what that is. Um, and then I want to explain, how how Jeff and I would approach some of the test, and then how would we approach helping those clients who suffer from balance issues. And then in addition to that, like, why is it so important for an athlete to have proper balance, right? And then and obviously that the the client who's 65 and over. Why is it so important for them? Okay. So the first step is, what is balance? So balance, the brain is getting information from three systems. They're getting information from remember we talked about this, that the nervous system, the way it works is it has a series of different receptors, right, that receive and send information, right? And they send it along these different pathways, right? And that's how function works, and from the nervous system's point of view. So with that said, the brain is getting information from the muscles. Those receptors are called proprioceptors. When you hear the term proprioceptors, they're receptors that send and then transmit from the muscles. Okay, so especially around your feet, you have receptors, and the brain, those receptors are sending information to the brain. The two other systems that are very important that the brain is getting information from is the visual system and the vestibular system. Okay, so let's break down what the vestibular system is. Okay, the vestibular system has three. If you look at it, this would be a circle. This would be a semicircle, right? So basically, the vestibular system has three semicircle canals, right? One in the front, one on the side, right? It's called the lateral or horizontal, and one in the back. So ultimately, the front is anterior. That's what they call it. The side is called your lateral uh, canal, and in the back, they call that the posterior canal. Okay, so you have three. You have three on each side, three semicircle canals. Front, which means anterior. Your side is your horizontal or lateral, and in the back is your posterior canal. Okay, um, and what these three canals on either side, they get activated. Okay, what happens is a semicircle and fluid gets heated, okay, in these canals when the head is moving and the head is in certain positions. So what happens is fluid. Then from the fluid, what happens is you get activated these hair cells, because there's hair inside of these, and these hair cells will stimulate a group of cells called the ganglion, will then activate a nerve, the vestibular nerve, and they activate the vestibular nuclei. And then from there, these head movements, okay, this pathway will activate the eyes, right? So for the eye muscles, right? And then what will happen is that so you'll have, and then also you'll get information from your visual system. So this was now, besides these ear canals sense, like when the front ear canals get activated, the head is in rotation down. Okay, when the lateral canals get activated is when the head rotates from left to right, and the back ear canals get activated when the head goes back. Okay? These are called rotation because the head is moving at an angle, okay? Called rotation. Okay. Next to these ear canals, you have these crystals, okay? And these crystals represent an area called your otolith, which those area gets activated. Okay, you have what we call the saccule and the utricle. The saccule gets activated when we move in a straight line up, down, forward, and back. Okay, up, down, right, forward, and back in a straight line. What's the difference between like so this is rotation, this is at an angle, this is a straight line forward. So when the head comes forward, you're moving at an angle, right? When you move in a straight line, you're translating forward and back. Okay? The utricle is the other part of the linear system, gets activated when you move lateral. So when you move in a straight line left and right, and when you head tilt. Okay? So when you have a head tilt. So those make all those movements make up your vestibular system. Okay? So your vestibular system is sensing when the head is in certain positions, okay? And then they in concert will activate certain muscles, and then if your head is moving, certain muscles in your neck have to fire, and then your eyes will move accordingly. Okay, because I want to talk about why the eyes. In your body, we have different types of reflexes. Okay, they're built into the nervous system, right? So like when you go to the doctor and you tap your knee, you have the tendon, a reflex that when he taps your knee, if the reflex works, you're going to extend you're going to extend your leg. Okay, so you also have reflex. So you have reflexes all over the body, right? So one of the reflexes that you have is a vestibular reflex, and we're going to share why that's important. It's called the vestibular ocular reflex because your vestibular system and the way your eye moves are linked. The way your head moves, which is your vestibular system, is going to activate neck muscles, right? And it's also going to have a big play on your on movements in the eye. So again, balance is made up of three systems, right? Balance is made up of the brain getting information from muscles, the vestibular system, right? And the visual system. The vestibular system, right, is made up, is connected, so is activated when the head moves. So in certain positions, so if the head moves, certain neck muscles are going to fire, and the way the eye muscles and eye movements are gonna fire as well. Okay, what happens is in order for us to see when we walk, it's very important, the eye has to be looking at horizon straight ahead. Well, when we walk, our head will move, right? It's called perturbation. So perturbation means the head is going to move. Well, in order to compensate and make sure that we could see straight ahead, when the head is moving, the eye must move opposite. So if the head moves back, the eye must move down to be able to look at horizon so we could see while we're walking. So if the head moves left, the eye is going to move right. That's a classic reflex called your vestibular ocular reflex because it deals with the way your head moves, the way your eye moves, and it's a reflex. Now, commonly, when you have when the brain starts to demise, that reflex gets worse. So the brain starts to demise, that reflex will get worse. However, the cool thing is you could retrain that reflex. Now you could directly retrain it. So if you move your head to the left and your eyes don't move to the right, you could give them exercises where you have them move your head to the left and you look at a target. Sometimes that works, or sometimes you need to look at other exercise that stimulate other areas that will heal that area of the brain. And that's kind of what we do in a functional. Functional means that one area connects to another. So if this is the area that's a problem, you give them exercise and they don't get better, then we could find other areas that communicate and work better. We go to those areas first, and usually with with the amount of sets, reps, we could figure out an exercise that could activate this area and usually rehab and help tremendously. And that is the secret of what we do, is understanding how everything links together and being able to look at each person as an individual and design an individualized program. So again, the three systems that the brain is getting information from is is muscle system, receptors in the muscle called proprioceptors, the vestibular system, which is made up of the ear canals, the three semicircle ear canals, and those two little otolithic crystals. The ear canals, rotation, and the otoliths, linear movements, up and down, forward to back, left to right, and head tilted. Okay. Now, and then your visual system, what you could see. So again, the receptors in the muscles, the vestibular system, right, which is your head movements and eye movements and neck muscles, and your visual system. Those three systems, the brain gets information and now starts to make a computation and a plan, and then it decides from there, from those information, on what muscles to now fire back to keep us upright and stable. Okay? So when one of those systems is off, okay, when one of those systems is off, it tries to compensate, but as a compensation, their balance, well, they'll get much more unstable and unsteadier. Okay? So one of the things that you could do, and I'm going to show you in my course a couple of things, is, let me go down here.
So Andrew, while you're looking that up, just to be clear, when we talk about the ear canals, and you talk about the vestibular nerve, that's giving information back to the brainstem, correct?
Yes, yes.
Okay.
And then the brainstem is basically, so where the vestibular system sits is in the brainstem. So basically, the vestibular system is part of the three systems,
right,
that the brainstem is coming back and getting all this information. One of the areas it gets information from its own area itself is a brainstem. And then that brainstem makes a computation, sends it to the cortex, and the cortex now will fire the muscles that you need to be upright and balanced.
right.
Okay. So again, that computation is going to be distorted by how well how well those three systems are sending information to to the brainstem itself. Okay.
Right.
So what do? We could do, and I'll show you here in the course here. One of the tests we do is to look at someone's balance. We run this all the time. Okay. Is what we call a Romberg test, right? So we do a Romberg test. And what we're doing with the Romberg test is ultimately people are putting their feet together, right? They're putting their hands at their sides, and then they're closing their eyes. And they're seeing a couple things. One, yes, so we are taking vision out, because one of the things we want to do is really look at the vestibular system. And that's a huge, because it's such a huge system. And the vestibular system sits into the pons, which is in the middle, lower middle tooth, well, the middle of the brainstem. And basically, that system is a very powerful system. So we want to see, when we put people, we have them stand up, we put their feet together, their hands at their sides, and then we're closing their eyes. So yes, we are taking out the visual system. We're also, in a very narrow stance, kind of taking out the muscle system, right? And then we're really focusing in a lot on the vestibular system, because one, that's where the information is being processed, but also that it's an area where that area, the brainstem, is also getting lots of information, because that's where the vestibular system sits. So what we're looking at, one, when they put their feet together, hands at their sides, and they close their eyes, we're looking at, one, where's their sway? Do they sway forward or back? It's the first thing. The second thing is, are they swaying more to one? What's their first direction that they sway? Is it left or right? Okay. The third thing is how big the sway is. Okay. So three things you're looking at. So you're looking at the balance test. You have a client, or client they could do it their own self-test, or they could do it with a family member. Stand up, they put their feet together, right? They close their hands are at the sides, they close their eyes, right? And once they close their eyes, okay, you're looking at a couple things. You're looking at their direction of where they're going to sway. So are they going to sway forward or back? And then are they going to sway left or right? And then how big is the sway? So commonly, when I've seen and just experience, when the brain starts to demise, okay, the first thing that I see is that they're usually going to sway. Their sway is going to be more posterior. They're going to sway back. So the brain thinks they're falling backwards. So usually in that case, their eyes are very dominant down, because here's horizon. If I'm falling back and I need to see horizon, my eyes need to be dominant down. Okay. What happens is, then they'll have a sway either left or right. So usually I sway back, and I'm either going to go left or right. Now, what happens in people who have strokes or Parkinson's, their brain has demised even greater. And what happens is, as their brain is demising, their back, the brain has to compensate, and it angulates forward, especially in a stroke or even in Parkinson's. And now their center of pressure is much more forward. So you put their feet together and they're going to come forward, and then they're going to sway either left or right. That's usually what experiences, kind of what I see. So how do we correct that, right? Well, if you think about it, you want to give, if they're, just say you put their feet together and their eyes are closed and their hands at the side. So let's say they sway back and they sway to the left, right? So normally what I'll do is I'll give them some kind of vestibular, and we're going to show you a little bit of, some of the fields in my VR program, but we'll give them exercises that will, so they're going back, so their back ear canals are going to be firing to push them back, right? So we try to give them exercises to stimulate the front ear canal. And what I usually do, what Jeff does, is we give them exercises. Sometimes we give them both. And then because if they're swaying a little left, we might give them that front left ear canal. So the both front ear canals and then the left front ear canal. And usually you'll see dramatic changes in that kind of work. And you'll see dramatic changes in their balance. I mean, I've seen it over and over. So again, the brain. So why do we use the vestibular system so much? Because let me share this with you. When the vestibular system is such an important system for your gait and also your posture. So here's the thing, and balance. So when you heel strike, so when you walk, and let's say my left heel is going to strike the ground. At the same time, my left heel is going to strike my left ear canal, my left back. So if it's back, my left posterior ear canal is going to fire that whole posterior, it's going to fire that. I'm now striking the heel, and now I'm going to get heel strike. So I get from heel strike to now, foot stance to now pushing off. We need that whole posterior ear canal is going to fire when you heel strike. So the second thing is when your balance is off, chances are your posture is going to be off, right? And then chances are your gait is going to be off. So by just looking at someone's balance, you can improve their balance, you can improve their posture, and you can help them improve their gait. And I've seen that. So again, with people who, like in their Parkinson's, people that have a shuffling gait because their center of pressure is more forward, we tend to give them exercises for the posterior canal, right? So what I've seen is the people who have, like, your first line brain is demising just a little bit. And when I mean demising, I'm not saying you have a tumor. What I'm saying is that the circuits are not firing the way they can, right? They don't have any physical pathology. They don't have a tumor. They don't have a vascular event, but they're just off. Their balance, and because their balance is off, their posture's off, their gait is off, and they just feel very unsteady. So in that case, you'll see that when you do your Romberg test, you'll see that you'll put the feet together, hands at the side, and you'll see that they'll have this posterior, or they'll feel like they're falling backwards. Eyes are going to be dominant down. So in those cases, we usually give them head movements, like their head forward, and usually we'll give them like that. Plus, we'll couple that with giving them a head movement that will activate either the left or right ear canal, because they'll come back and they'll usually sway either, to the left or the right side. So if they sway to the left, we'll give them more left stimulation. So we'll give them both front ear canals, and then we'll give them the left front ear canal. And usually that can make, and not a lot of reps. Okay, what we'd like to do usually is maybe 2 to 3 reps in each exercise, or 1 to 3 reps in each exercise, depending on how fatigued their system is. And we're going to do a whole kind of podcast on what is neurological fatigue, but not a lot of reps. But we want you to do the exercise a couple times a day, and you'll see. But again, as we talked about with neuroplasticity, between 7-10 days, 2 weeks, you'll start to see it right away, but the changes won't last. But as you do the exercises 2 to 3 times a day, over 7, 10 days, 2 weeks, you'll start seeing the changes stay, and you'll see unbelievable dramatic changes. And when you get their balance better, one, their brain is overall functioning better. Number two, you're going to see that their posture is better, their walking is better, they feel much more steady. Huge, huge, huge changes. And we're going to do a whole nother also podcast about perception, because even though sometimes we'll do a podcast that we could see that they're better, they can't feel it, and we'll do a whole podcast on people's perception in the parietal lobe, and why that is, and how we can restore that type of function. But
Andrew, just jumping in on the Romberg test, I think it's also important to note a very common term in functional neuroscience, which is cross-cerebellar diastasis, which is that information coming, say if they fall right, we know that pathway is coming from the right side and communicating to that right side cerebellum, which would give us a keyhole to what's going on to the left hemisphere.
brain. Yeah, yes.
And so,
yes.
I think it's important to note too, with, part of the rehab part is we can also do some stimulation to the cerebellum, but it also can really give us a good idea of what's going on from a hemisphericity standpoint.
Yeah, that's a great point. So one of the things we look at is the direction usually that they sway to is the weaker cerebellum, and the weaker same side cerebellum and weaker contralateral brain, right? So just say they fall to the left, right? Usually the left cerebellum is going to be weaker, and usually it's something, the circuits, the asymmetries, the right brain isn't firing, whether the right brain's firing too high or too low, the firing rate of that right brain is off. So the left cerebellum is connected to the right brain, and vice versa. The right cerebellum is connected to the left brain. So it gives us a lot of the asymmetries that are going on, and also what parts of what side, all the asymmetries in the cortex and the asymmetries in the cerebellum.
Right.
So that's a really good point. So yeah, so we do this on every single client, whatever condition they have, whether they have a concussion, traumatic brain injury, stroke, Parkinson's, movement disorder, balance disorders we're doing, but whatever condition they have, pretty much we're always checking how well their balance is. Okay. Always, always, always. It's one of the most important things that we do. Okay. So the second thing, a couple other things I want to talk about. So when I talked about vertigo, so I want to talk to you about that as well. So one of the classic vertigos that people have is they call Bppv. And what that is that we talked about the ear canals, right? So we talked about the ear canals. We have 3 of them on each side. We have one semicircle, the ear canals, one in the front, one in the side, one in the back, right? And we have next to these ear canals are these crystals, or these otoliths. And the otoliths, so the canals, rotation, right? Down, or flexion, extension, rotation right, rotation left. And then these otoliths, the utricles and saccule, basically when we translate forward and back. What happens is those crystals sometimes could break off, and they could actually get stuck in one of the ear canals. Generally, not all the time, but most common is they get stuck in one of the posterior canals. So just say and what happens is when you move your head in that position, the rate that they fire is abnormal, and that abnormal causes a sensory mismatch, and it causes either you to feel, the client, that either they're spinning or the room is spinning. Okay. And what happens is the way you can look at it is you could put the client in that position and you could see if they have a nystagmus. And what that means is that they have an oscillation. So what happens is the way that works is in the left ear canal, if they have in the back posterior left ear canal, if they have the Bppv, when they put the head in that position that's going to activate that ear canal, what's going to happen is it's going to cause the eyes to go opposite, right? So it's going to actually have the eyes go down, if it's the back left ear canal, down to the left, and then come really back fast up to down to the right, I mean, and really fast, it's going to come back up to the left. So you put them in the position, the eyes will go like that, and it's going to go boom, and it's going to keep doing that. And that constant going back and forth, going down to the left, down to the right and up to the left, that is called an oscillation. And the oscillation in neuroscience is called a nystagmus. So they'll basically have a nystagmus up to the left because you put them in that position, and it's going to cause their eyes, the vestibular ocular reflex, to go. If you put them that back ear canal, it's going to force their eyes to go opposite. It's going to slowly go down to the right and then fast up to the left. And that constant back and forth, it's going to appear that the eyes are oscillating up to the left because it's that fast movement. It's going to slow, fast. And if you consider doing that, when you're looking at the person's eyes, it's going to appear their nystagmus or their oscillation is up to the left. And in that case, you see a skilled practitioner like Jeff or I, and you can do it over Zoom because but if they come to the office, it's a little bit better because you can teach them you put them in exercises ultimately that basically get that otolithic or the crystal out of that canal. And usually once you do that, that usually corrects the problem, and then the sensory mismatch goes away.
Right.
With people that are 65 and over, I see this all there. Just remember this in general, that as we age, our function is going to demise at some point, right? So even if you run and you take care, it, even if an example, you see amazingly Tom Brady, and he works so much on his body, the mental part. He's great, incredible that he's won his 7th Super Bowl, but probably there's aspects that his probably consciousness has gotten better, his focus has gotten better, but there's probably some aspects of his physical abilities are probably, even though he's playing at a ridiculously high level, might be maybe his arm strength's a little less, but he puts so much work into where he's still playing at a ridiculous high level. So, but just in general, as you age, you're just things aren't going to function as well, and you have to put that much more time to function at a very high level, especially like him. So if you do nothing with your balance and don't work on it, when you get from 65 and over, your balance is going to drop and demise. So it's important, very important, because one of the biggest things that happen to people at 65 or older is the probability goes up that they can fall and they could break something. So in order to inhibit that, really important to see a practitioner and get a balance evaluation, right? And then work with a program, a simple program that can help restore or improve or get their balance better. So that's another aspect. And one of the things I wanted to show this, during our podcast is, my brain exercise software. So if you look up if you look up, I'm going to share my screen here. So if you look up uh, rotational chair, or if you look up a company called Gyrostim, Gyrostim, it's an incredible device that does automated vestibular therapy. The device is incredible. So I'm going to give just some things that I see. I think if everybody could afford this treatment, it would be incredible. The challenge, and I say this, is the challenge of this is that the device is usually cost the practitioner about $250,000. I think there's about 25. Don't quote me at that number, but there's maybe more out there. But because the cost and the size of the machine, not every practice has it. So now what happens is, because the cost, it's very rightfully so, it's an amazing therapy, but at the same time that it does cost. So people that can cost, they can do this, and they know of a place. This is great therapy. So this is not against anything, because this therapy is great. And my mind thought about was, how can we get a therapy like this out to almost everybody? And the way to do that is, one of my software has 6 brain programs. Breathing program. Our second program is a virtual reality vestibular program. So we took the aspects of rotational chair vestibular automated therapy, like a gyrostim, and we developed our own version through virtual reality. So because we've been able to do that, we've been able to simply put this on people's phones, and then have a very simple $30 VR headset that they could use from Amazon. We recommend the VR headset from Amazon, and they could do very targeted vestibular therapy. And we're going to show you how. So again, we have 6 programs. We have a breathing program, virtual reality, vestibular, which we're going to show you, called Activator. We have virtual reality eye movement program. There's 6 parts. We have visual motor imagery, so pictures different body parts for chronic pain, dyslexia, phantom pain. We have a sound program that also helps the balance, okay, because we're going to show you that as well, and a 2DI program with 7 parts. So I'm going to share with you this program called Activator. Very special program. It's a virtual reality, a rotational chair therapy that mimics rotational chair automated vestibular. Again, those machines are incredible, and if people get a chance to use those, they definitely can. What ours is we replicated in virtual reality, so we can get more people at all economic backgrounds. And the limitation is there's only X amount. So even if you're an athlete and you could afford to do it, might not be in the city that you're in. So with ours, we could control the settings, put it on the phone, and you could do it all the time. So you could see here, it's a person sitting in a chair. Now we have a basic background that we can control the colors of the background. So we can make it either very light, dark, or specific color. And then here we have the target color. So the target we have is just a dot that we use, and then we have different colors that we can make the dot, different sizes, okay? And then here, in addition to a basic background that we can control the colors of the background, we could actually make a specific background like the beach, okay? Or we can make a golf. So I have a park, and the reason why we do this is because in the brain, okay, anytime you give the brain a reward, something it likes, whether it's food, a scenery, a picture, the brain is going to ramp up its ability to activate dopamine. And that dopamine is going in the brainstem, in the upper brainstem. Dopamine is going to stimulate the brain, the cortex, the limbic system of the cortex. So the cortex, then the limbic system, and the sublayer of the brain called the basal ganglia, which the basal ganglia has an influence on the eye movement, the eyes, the way the eyes move, the cognition of the brain, uh, the emotions of the brain, and the movements of the muscles. The movement that has an influence on all those pathways. Okay, so just say we put a beach, then we have access to combine movements together, or we can have movements that are going on simultaneously. So the movements that are going on simultaneously, we have 18 different directions that we can move. So we talked about the ear canals. We could actually stimulate these ear canals forward, back, right, left, tilt, right, tilt, left. Then we have all the translational, the otolithic pathways, up, down, forward is front, back. We have left, right translation, and we have even up the stairs and down the stairs. So because we're computer oriented, this system can actually, we simulated what it would be like going up and down the stairs, because people who have concussions, traumatic brain injuries, they commonly have issues a lot of times with going up and down the stairs. And once we could get them to a certain point, we could specifically rehab them and put them in those positions. Obviously, you could see each position. Some of them we can change the degrees of motion, like 180, 90, 360, 60. Each position we could have a different speed or the same speed, different reps. Some of the positions we can have going in one way and coming back, or just going that's one direction. And then we have the otoliths, and then we have combined motions to get the very, very specific, either left anterior, or I mean either the specific side, either left or right anterior canal, or left or right posterior canal. So we could get extremely targeted with what we want to stimulate, and it's a perception therapy. Basically, once we put these settings, we send it right over to the phone, and those specific settings stay on the phone, and they could do this all day long, wherever they are. And that's the beauty of our software. Again, if you have a chance to go to work with, I know there's a place, if places that have rotational therapy, there's different rotational chairs. A popular one is the gyrostim, but there's different rotational chairs. If you have the means to do it, it's a great therapy. If you have the means, as far as traveling there, if you have the means to the financial means of what they cost, it's great. But a lot of times, you're only seeing those places a certain amount of times, and then you need follow-up care after that. And that's why we're talking to a lot of these practitioners, whether they have a rotational chair or not, because people need follow-up care. And our software can be controlled anywhere on our dashboard by the practitioner for their client, and we could put a very customized program right on their phone. So this program I've seen work with people with balance disorders, Parkinson's, strokes, traumatic brain injuries. I mean, I've seen this program is probably one of our most popular. We have them all on the phone, but we use this tremendously. And the reason being is because balance is so important to help somebody improve their health. Some people are coming in specifically for balance, but some people that are coming in for other things, we see their balance is off, and we need to correct that because it's such a big marker of overall brain health, having good balance. So we're using this all the time. So not only is it stimulating the balance system, but the vestibular system can project to other parts of the brain stem, and it could project to the brain itself. So we're using it from everything from cognition to memory. So we're using it in all sleep, in all sorts of facets. But for balance, it's unbelievable. And again, because we're functional, we might stimulate that part of the brain that might stimulate areas that can help sleep, that can help attention, focus, memory. So we're using it constantly all the time, and it's a huge marker for brain. This program is just absolutely incredible. So I just wanted to share that with you. Again, you're rotating. If you come back to here, you're rotating in that chair, in that environment. Like I have a client who has Parkinson. We are using it for his tremor, and actually, can I bring that video up, Jeff?
You can. I don't know if we're going to be able to advertise that, if that makes sense.
Okay, that's fine.
So
we'll wait. We'll wait until. Actually, it's good. The client I work with probably give us permission. So maybe next
right.
podcast when we come in, we'll share a video, and he's actually using activator. You could see like him and like his right hand holding like a knife, and it's like this, and then he'll do the activator. And what we did in activator was, because we're trying to drive more dopamine, and he loves golf, we put him in the golf scenery, and specifically we were able to activate his right cerebellum, right? And because the tremor was on the right side, and what we were able to do is, you could see the second video that it's like hardly any movement at all. So again, someone who's a Parkinson's tremor has been using this. So I mean, now we're using it also in addition to improve his balance. But I mean, we've seen this work in many different types of conditions and improve a lot of different types of functions. It's a unbelievable product. And again, I had an idea when I was developing the software that I thought rotational chair therapy was huge, and the vestibular system was huge. And again, I think that people could see those people are awesome. But those people who see those therapies at the same time, I thought that uh, they're going to need something to follow that up, and that's where our software can help in that instance. And then the people who say they can't get there, whether they're an athlete and that place during their season isn't in their season, um, our software works because the practitioners like myself could be anywhere, right? And we can control the settings, and we put it right on their phone, very customized. And all they got to do is log in and press play. And then the third, so one is when you go, if you could go to rotational therapy, it is great. But then after you leave there to follow up, our software is excellent. That's one. Two, maybe you could afford it, but you just can't get to a center near you. You're an athlete, it's in your season, you can't get, and you need that kind of work. That's where ours come in, because we put it right on your phone. And the third, where it works great, is maybe you would love it, but you just couldn't afford to go out there. Whether the time you have the time, but you couldn't afford to pay whatever their prices are. For a fraction of the cost, we put that on your phone. So in 3 different instances, our software could work and have tremendous value with the with someone's balance. Now I want to show you. I want to go back and I want to show you what we call equalizer. And equalizer is also used for balance, because certain frequencies, we talked about those ear canals, the front horizontal, right, and the back ear canal, the semicircle canals, will sounds, because the 8th cranial nerve is called the vestibular cochlear nerve. Vestibular is head movements, head, neck, right, and eye movements, and the cochlear is sound. So it's the vestibular cochlear 8th cranial nerve. 100 hertz activates the front and the lateral canal, and the 500 hertz activates the back canal. Okay, the utricle, the translation left and head tilting, also gets activated with 100 hertz, and the saccule, up and down, forward and back, gets activated with 500 hertz. So we can activate, so some people that have a very sensitive part of the vestibular system that have a hard time, and fatigue, which is not all the time, but sometimes it happens, we can use actually sound to activate that vestibular system. So again, this is all on our software. We put it on. And again, you see here, we could activate either both ear canals, or we can activate either left or right. So we could get very specific, the beats per minute, how fast the sound comes out, and the time, the sound, we get a pauses in between. We have 5 different combinations we could use. We could have sets, pauses. It's very, very customizable. So if you're a practitioner that's out there and you work with vestibular or balance, the Accomplished Brain software would be amazing for you. If you're a client and you want to improve your balance, Jeff and I would be great contacts. And as we're leasing the software to more practitioners, we'll have hopefully, more practitioners in your area. But obviously we do a lot of Zoom calls, so we could see anyone anywhere in the country or the world, and we can help. So we can help the client itself, working with them, or we can help the practitioner. Our goal is to get this out to more practitioners. So together, us and the practitioners, work I'm doing, Jeff's doing, we're helping clients, and then the work we're doing with the software and the courses, we're trying to get more practitioners. So together we can help more of you people, the clients that are out there. We want to improve your health. That's our mission.
Hey, Andrew, I think it's really important to note that virtual reality in the past 5 years has actually started to be used quite a bit in therapy when it comes to spinal cord injuries, when it comes to people trying to rehab, getting their toes to move again, getting sensations, so on and so forth. But I bring that back to when you talk about the gyrostim and our virtual reality stuff is, for you and I, if we were suffering from Meniere's disease or we had a balance issue or something like that, you can't just walk into a PT clinic and say, hey, can I use your virtual reality program? Because no one has it. Those programs that therapists are using at spinal clinics, they're few and far between, just like the gyrostim is. So this is like literally the only thing out there that you can do in the comfort of your own home or in the comfort of a practitioner's office. And I think that's something that's really unique about it. And for a practitioner, it's a great way to differentiate your practice, is having this be a part of it, because you can't find it anywhere.
Yeah, and I want to share a couple things what we're going to be doing in what we're doing. And so we kind of have finished our phase 1. We're in our phase 2 now. We're developing our automated payment system for practitioners, so everything is automated. We should have that done by beginning of April, and also we'll be offering a month free. So we feel really confident that if you guys get in this to work, I have a practitioner who is a incredible guy. Tony is a great guy. Bought our course, and I'm working with one of his clients now. He's on site, and I'm working. He's a really smart guy. He's really smart in neuroscience. He's really smart in rehab, and he's really smart in bioelectrical physiology. And he brought me in to learn a little more about the software. So he brought me in with his client, and I'm online. He's at the site, and his client had a hemorrhagic stroke, and we've been seeing amazing results with the software. And and I'll probably hopefully get him on as a, and get permission, where get a testimonial from him about how well the software is working. And I'm doing this, one, I want to help his client, and 2, I want to help him because he's such a great guy and he's very open and very smart, and he's seeing the value of what we're doing with the software. And the thing is so we're in the phase 2, which we're going to be building a mirror therapy program. So people who have phantom pain, people in cast boots, when they move their left hand, we're going to have a VR program. When they move their left hand, well, say they have a problem with their left limb, we're going to move their right limb, and basically, like, they'll appear that the left limb is moving because the camera will take a picture or a video of, it'll see the camera, the right hand, but when they view it, they have the VR headset. It's called mirror therapy. We're also going to do an augmented reality. So we're going to do a whole thing, I think, a podcast on the difference between augmented and virtual reality, but we'll just mention we're going to do an augmented reality reaction time training program. And then we're going to try to, we're developing an app actually to measure the balance. And that will go to our database, which we're also developing a data management and analytics. So we're developing that as well. And then we're gonna automate some of the evaluations. We have an evaluation database that could keep track of 523 tests, including labs, but we're gonna automate some of the evaluations. So like the balance, we're gonna automate the eye movements, we're gonna automate the heart rate, pulse, temperature, oxygen, heart rate variability. That's all going to go into our cloud on our dashboard, and then the practitioner will be able to analyze this. So now you're talking about getting so pinpoint on the therapy. And remember that this software is for practitioners, for them and their patients. So when you work with me, I'm the owner, and when you work with Jeff and I, we're also dubbed as practitioners. So when you work with us, I'm a practitioner. So we're developing these customized programs that we put it on your phone. And the unique thing is that all you got to do is log in and press play. But it's a very customized program to you. So the practitioner has the flexibility to evaluate, analyze the data, see all the program changes, and then develop a customized program. And then the patient, all the client has to do is, it's very customized to them, is log in and press play. Okay. You could see when I talk about this, I'm just so juiced up because the fact that we could have at the fraction of the cost to do all these therapies, and then you could be on your own, and you don't have to travel. I mean, again, that's not to say that some of these big clinics out there that are amazing, that have all these therapies that you can afford to go, I recommend. But the challenge is not everybody has the time, and not everyone has the resource. The people who do, I recommend to go to those. There's a lot of places out there, and they're intensives, and they're good, and I think they're excellent. But the people who don't have the time, I think this would be great. Now, the other thing I wanted to say is an athlete. So if you think about an athlete, an athlete is about this. It's a very, if you could share these principles, and this is very general stuff. So people who are very detailed trainers, this is very just general stuff. So people who are detailed trainers, they look at it in a much more detailed way than I'm going to say, and I think they're great. But in general, for an athlete, it's very important for them, their posture, right? It's very important that they can load their body, right? So they got to be balanced, right? So that's where their balance comes in. So they can load, and they can load the right combination of muscles, right? And then they can explode, right? And then they could also decelerate. And the brain has a huge effect in that. The balance system has it. Now, that doesn't mean that like all the very detailed work that the trainers do, I think it's incredible stuff. And looking at the range of motions, and looking at the biomechanics, and looking at the physics and the biomechanics, all that's extremely important. But I think another layer that could help is how the brain is perceiving where it is in space, and how the brain is perceiving where it is, the body parts in relationship to the other. And then to go along with all the great physics works, and all the great measurements and the angles and the training and the core and all that stuff, then you add this other layer that now the brain understands where its body parts are in space. It understands their balance is much better. All those things that the trainer is doing and all the great work that the trainers do, that next level up of the brain could just add a whole nother level on all the great things that the trainers doing with the athletes. So the trainers and and athletes, this stuff would be, highly, beneficial, to make sure. And again, what, that's, we're doing one little piece, and then all your trainers doing all this other amazing stuff, the nutrition trainers doing all the recovery stuff, the trainers doing, looking at all the details of every muscle and the relationship of the muscle, the joints, and how they work together. And then you add this other layer, this brain layer, and the brain understanding where the vestibular system and the ocular system. And man, it takes it, whatever the trainer is doing and the great work, it takes it to that next level. So that's another way. So again, you could look at the really compromised person who has a concussion, traumatic brain injury, stroke, Parkinson's, right? You have the athlete, and then you have the person who's 65 and over, who, one of the things you want to prevent is them from falling. The balance work, a balance training would be huge in all those populations. Would be the people who have a neurological issue, person who has, an athlete, who wants to, who has this next layer that could really help them, and to the all great work that they're already great trainers are doing with them. But again, with all the range of motion, all the biomechanics, the physics, that the way some of these real top trainers are looking at things, and then just adding that little layer, and it could be amazing. And then the people who are above 65, to decrease their risk of falling, those three areas can help. And again, if you have a rotational place you could afford, you could go. It's a great place. And again, but if you go to those places, you're going to need follow up, and that's where our software comes in. If you're an athlete, you can afford, but maybe you're in season, don't have the time, our place works again. And then if you're someone who, can't afford to go there at a fraction of price, you're doing virtual reality all day long with our system, that can help. So with that said, obviously, I think I talked probably even more than my time. But as you can see, I'm so passionate, and Jeff is so passionate. We're both so passionate about this work, about the brain. We're constantly learning and growing and sharing. We just want to share information. And again, what our stuff about the software is, we put, especially when I put we put a lot of time in the course, and then the last 3 years, and it's just continuing to work with clients and reinvest into keep making the software better, because we really believe that, how do we help more people? How do we help more people? How do we help more practitioners? And how do we help more people? And how do we share this information? And that's why we talk about the software a lot. We talk about solutions. We talk about things that can help. All we want to do is just add value to you guys and just want to help more people. And that's why I want to get this stuff out there.
For sure. For sure. Awesome, man. That was great. Thanks so much for coming, guys. And we are looking forward to seeing you next time.
We'll see you next time. Great.